Cancer is a continuously growing global health problem that poses major challenges, most especially in developing countries. Find out how this international distributor of innovative health products came up with a series of solutions to help increase a patient's chance to survive the odds. In 2020, the Philippines hit a record of 354,398 prevalent cancer cases within a 5-year period. But because of poor access to health care, especially for people living below the poverty line, the advances and breakthroughs in cancer remain unattainable to many.
Cancer refers to a group of diseases that's characterized actually by cell growth, abnormal cell growth and proliferation, inflammation, as well as angiogenesis or formation of new blood vessels. It always starts with mutation in the genome or the genetic makeup of a person inside the cell. Before PPARs, most of my patients, they were unable to finish the chemotherapy regimens because of the side effects and because of discomfort during the process of chemotherapy.
Maria's son Dominic was diagnosed with stage 4 rhabdomyosarcoma when he was only 4 years old. While coping with the recovery of her other sick child, Maria found it hard to accept Dominic's condition.
It was actually very devastating kasi with Dominic, it was manifested mga 4 years old na siya eh. Unlike dun sa daughter ko na congenital talaga, baby pa lang. Yung mga bandang September, meron ng umuumbok-umbok dito sa leeg niya. Hindi ko talagang iniisip na cancer kaagad siya until nag-nosebleed siya.
Dominic was prescribed chemotherapy, but his family insisted to rush to an integrative doctor to seek for alternative cure.
Medyo hesitant ako kasi as a mother, I know the side effects ng chemotherapy kasi. So what I did is that I rushed towards the integrative doctor of my daughter, who happened to be PPAR partner doctor of Simply Nature.
One of the hardest decisions to make for people living with cancer is choosing the kind of treatment that would work best. To help patients and their families deal with this growing health problem, one company commits to producing safe, credible, and natural health solutions by drawing on the latest bioscience technology to deliver a series of safe, efficient, and natural products. What is Simply Nature and what does it do?
Simply Nature is a company we created and founded about 10 years ago. Our mission is to find effective health solutions for people. So we provide natural products that work in combination with conventional therapy and medicine.
As an international company that provides natural solutions for cancer, metabolic syndrome, and degenerative diseases, the management upholds a health philosophy that centers on whole food nutrition as the frontier in health management.
When we talk about choosing treatment, especially in the area of cancer, patients are really afraid of chemotherapy because of its side effects, and they tend to then look towards natural products. But this is not a either conventional or natural choice. At Simply Nature, patients can have the best of both worlds. Our protocols work with conventional chemotherapy to minimize its side effects so that they can get the best treatment using both conventional and natural together.
Cancer is like a virus. It continuously evolves, it mutates. So it can develop defenses against our usual treatment modalities like chemotherapy.
Like I said, chemotherapy and radiation therapy have a lot of side effects. So more often than not, patients stop their treatment because of these side effects. It's very important to have the support.
With the supplements that we give the patients, there will be lesser side effects, so they will be able to finish their chemotherapy protocols more comfortably.
This company introduced PPARs, which is touted as one of the best natural ways of solving serious health problems.
PPARs stands for peroxisome proliferator activating receptors. It's basically a nuclear receptor found inside the cells. Now, when these receptors are activated, the benefit that you can get from that is, number one, cellular differentiation. Number two, it's to promote fatty acid metabolism. If you have better insulin function, your blood sugar will naturally go down. And another one is to induce cancer cell death by modulating the immune system.
As a sole distributor of PPARs, the company promotes its use to many reputable health institutions worldwide and actively organizes corporate health conferences and public health talks in Asia.
Simply Nature PPARs is made out of a special strain of these types of microalgae. It is very effective by protecting the bone marrow. We maintain the integrity of the immune system of the patient, which is very important to prevent infections and to fight off the cancer itself. And also, Simply Nature PPARs is also very dense in nutrients so that the patient can recover faster because of better cellular healing.
Sabi ko parang na-lead kami to an extraordinary and I must say amazing journey. I'm very proud of him. At a young age, na 8 years old, he believed that it's his purpose to siguro encourage other people then. We would like to really pay it forward with the knowledge that there's really like Simply Nature that can help people with cancer very much.
When fighting cancer, living healthy is very important because it allows us to pursue what is important to us in life, and that's what it's all about. When we can help a patient move from being bedridden to getting up, to be lucid in thought so that they can have conversations with their loved ones, it gives the whole process of fighting cancer a whole new meaning. And that is what drives us at Simply Nature.
In 2019, I was being diagnosed a cancer of my uterus. So I was shocked. Sabi ko, bakit nagkaroon ako ng ganito? Samantalang hindi ako mahilig sa pagkain. I'm sorry, basura. Started the tablet and then the powder.
The powder.
Tinry ko din yung yung tawag dito.
Gel?
Yeah,
Soft
yung gel.
gel?
Yes.
Yeah.
It's really good. After 2 months ng aking therapy and taking PPARs, sabi ni doktora, magpa-laboratory ka na. So, nung nagpa-laboratory na ako, praise God, 2 weeks ago or 3 weeks ago, lahat normal. To God be the glory. Salamat sa Diyos. Sa 2 months ko po ng aking pag-take ng PPARs, ako po ay cancer-free.
Napansin ng pedyan niya na maputla compared noong bagong silang kasi monthly na nagpapa-follow up kami. Maputla at saka medyo distended na yung kanyang abdomen. From then, doon kami nag-start ng workup like blood test, ultrasound, hanggang ma-CT scan and ma-work up sa hospital. Doon na na-diagnose na meron siyang stage 3 na yung kanyang tumor sa liver. When she started taking PPARs noong September 25, we decided na i-try at i-monitor siya within a month. So within a month, after 1 month, October 25, nagpa blood test and ultrasound kami. And we really thank God na there is a big improvement. For me, it's really a blessing yung PPARS because yung dating alpha fetoprotein niya na tumor marker ng liver cancer, which is 65, it went down to 14. So, almost 4 times yung kanyang binaba na from 65 to 14. At ang kanyang ultrasound din, lumiit din yung kanyang lesion. Before siya nag-take ng PPARS, it was 3.6 by 4 by 3.5 centimeters. After 1 month lang, malaki din para sa amin yung binaba niya na naging 3.1 by 2.8 by 2.7. So almost 1 lahat, yung 1 centimeter, yung 1 centimeter kahit 1 centimeter lang yun. Malaki na yun na pagbabago kasi 1 month pa naman eh. So aside from sa pag-decrease ng kanyang lesion, meron din kasing nakitang nodule sa kanyang spleen that measures 1.7 by 1.9 by 2 centimeters. After 1 month na sa pag-ultrasound niya, it's miracle for us because it's totally gone. It totally disappeared. So we are thankful, forever thankful for leading us to PPARS kasi we believe na ginamit ni Lord yung PPARS to help us na hindi mag-undergo ng surgery yung baby namin.
CA markers.
Mataas siya. Then, nung after 3 months, nung pag-take ko ng Simply Nature, doon, naging normal na siya until now. Kahit si Dr. Johan na gulat siya kasi biglang normal agad. In just 3 months, nag-normal agad yung CEA ko. 1 year and 5 months. Cancer-free. Dapat may food supplements kayo. Like Simply Nature na proven and tested ko na. Talagang hindi ako pwedeng mawala ng Simply Nature na yan.
2019, I was being diagnosed a cancer of my uterus. So I was shocked. Sabi ko, bakit nagkaroon ako ng ganito? Samantalang hindi ako mahilig sa pagkain. I'm sorry, basura. Started the tablet and then the powder. Tinry ko din yung yung tawag dito.
Gel?
Yeah, yung gel. Yes. It's really good. After 2 months ng aking therapy and taking PPARS, sabi ni doktora, pagpa-laboratory ka na. So, nung nagpa-laboratory na ako, praise God, 2 weeks ago or 3 weeks ago, lahat normal. To God be the glory. Salamat sa Diyos. Sa 2 months ko po ng aking pag-take ng PPARS, ako po ay cancer-free.
Hi, welcome to another, and we have a very practical episode today, right? Welcome, Doc Jansen again.
Hello, Sean. Hello, everyone. Happy to be here again.
And today we're going to do a more practical topic. It's about cancer imaging. So for those of you who have gone to see your own oncologist or accompany your family members, and the doctor said, okay, look at a tumor here, and you see nothing. Well, tonight we're going to take a whole look at all the different cancer imaging, and Doc will help us learn to see what the doctors see. So tonight's a bit more practical. It's going to be short, and don't forget, after this we'll do our AMA. Ask me anything. You can ask any question. Of course, most viewers will ask us about cancer, what to eat, chemotherapy, immunotherapy, which is the right protocol for you. We will do all that today. All right, Doc. Cancer imaging. Doc, every time when I see MRI scans are okay, but when I see X-rays, I don't see what the doctor sees. I can't tell that you guys can see all that.
Yeah.
But tonight we're going to go through all the imaging.
Yeah.
So is it going to be easy for our audience to be able to spot what you spot?
Yes. So I'm going to teach you the relatively easier ones. Okay. So you see what the doctors see. Okay. Now, this is also for you guys to understand why the doctor requested this specific type of imaging study. Why CT scan? Why not MRI?
Oh, yes.
Why MRI and why not CT scan? Why just request an X-ray?
We will always think go for the most expensive. Those of us
it's most
who are
accurate,
afraid, right?
most
Yeah.
sensitive.
But it's not necessary.
It's not necessary because each of these imaging modalities, yes, some may be superior than the others. However, even the more simpler imaging studies like the X-ray would be enough already to diagnose. Okay, so first, speaking of which, X-ray. So X-ray for lung cancer would already be enough to consider suspicion. Alright, so as you can see here in this image, this is a typical chest X-ray.
Yeah.
Okay.
I see a white spot. So for I guess the basic. What's the black spots? What's the white spots?
White spots.
Yeah.
Okay. Now, the white spots are bones. Okay.
Oh, so anything hard becomes white.
Yes.
Anything
Okay.
soft is dark.
Yeah, it's darker.
Darker. All right.
Now, you can see the black ones, right? The pitch black ones.
That's your lungs?
Yeah. Those are your lungs, which
Soft
are
tissue.
aerated.
Aerated.
Aerated lungs. Okay,
Yeah.
so inside that is air. That's why it's black. Okay.
Because it doesn't bounce the
it
radiation.
doesn't bounce the radiation. It doesn't.
X-ray, right?
Yes, it doesn't attenuate the radiation.
Okay, that's
So,
a big word, attenuate.
it doesn't stop, okay? It
It
doesn't
doesn't
stop
stop.
the X-ray. So
Alright.
what you are seeing actually in a chest X-ray are shadows.
Shadows.
Yeah. So remember when you were a kid, right? You use a flashlight, then
Yeah.
you
So by here,
create
it's the shadow is reversed.
shadows reversed.
The shadows are white instead.
Mhm.
All right. So that makes sense. Cancer tumor is you tell us is hard, right? So it will cast a shadow,
Yes.
a white.
A white shadow.
So
Okay.
yeah, Doc, maybe you
So,
can explain to us.
As you can see here, you can see the ribs which are fanning out along the sides.
Mm.
Then below there is a sac-like structure.
Yeah.
That is your heart.
Yeah, I was saying that's not the tumor, right?
Okay.
That's the
That is
heart.
not. Yeah. Yes.
Okay.
So you see the triangular shaped one. You know the spine, right? The spine
Yeah.
is in the middle.
On the right side. This
yeah.
here?
Yes.
This-
On that part, the triangular shaped one is your heart. That is.
Oh, it's so big, the heart.
Yes, that is the.
Oh, it's not
Left
this. It's not this
ventricle.
round thing.
No, it's not the round thing. The round thing is the
Oh.
tumor.
The round thing is the tumor.
Yes.
So so our heart looks nothing like a heart.
Yes.
Yeah.
It actually looks like your fist.
Okay.
Okay.
So that's the heart.
Yes. So that shadow, that part, okay, that is your left atrium.
Okay.
Left atrium above, you see the knob, left atrium, then below is the left ventricle. Okay? Now, adjacent to the left, in between, just above the left ventricle, is a round-shaped tumor. So that is suspicion for lung cancer. Now, of course, just by looking at this X-ray result, we cannot really diagnose the patient that, okay, what you have is lung cancer, because it can also be pneumonia. Okay, it can also be an infection. Now, to know for sure, to distinguish between is it an infection or is it cancer, is to check your history, what you're feeling. If you recently have had fever,
so if you don't have any cough, I mean you didn't have any flu, so it shouldn't be pneumonia.
Yes, so it shouldn't be pneumonia.
Then it's worrisome.
Yeah, then it's worrisome.
Possibly
cancer.
So this is the part that's the tumor.
That's
Alright.
the tumor.
Okay.
Okay, so in a chest X-ray, lung cancer looks like this.
Alright.
Right. So next, let's go to a more
Bone? Is this bone?
Yes, this is bone. Osteosarcoma. So osteosarcoma, you can look it up in our past video. So osteosarcoma.
Yeah, we
is
did a
just
special on bone cancer.
Yeah. So yeah, osteosarcoma is a bone cancer, more commonly found in kids. Okay. Now, to diagnose osteosarcoma, again, chest X-ray would be enough already.
Just an X-ray.
An X-ray would be enough. Now, as you can see here, this is the
it's
foot.
very obvious.
Okay, this is the foot of a kid. Now, take a look at the bones. Okay,
This
you have
bump
this.
here.
Yes, the bump. That is the osteosarcoma. But however, take a look at the bones, no? The two shafts. Okay, you have the tibia and the fibula. The fibula is the thicker one, going down, and the tibia is the thinner one.
The one on the right.
Okay, so along the tibia, as you can see there, the border of the bone suddenly disrupts.
Yeah,
And it
like a
forms
firework.
Like a firework.
Yes.
Okay, that's the osteosarcoma.
So is that actually bone fragments growing out? It's hard.
Yes, it's bone fragments growing out.
Wow.
However, these are not well developed bones.
So it will look like cartilage if you cut it up?
Yes, if you cut it up,
It's not smooth.
Yeah, it won't be smooth. It
Yeah,
won't
because you
look
can see it's like fireworks,
yes,
right?
it won't look like your
Your
chicken
smooth
bone.
It's
Yeah,
not so
it won't
smooth.
be. So it would be distorted. Okay, so that's your osteosarcoma. Now let's go to CT scan. Okay, so CT scan is usually used on the brain.
Okay.
Then it's also used for the chest, for the abdomen.
What's the main difference between a CT scan and an X-ray?
Okay, an X-ray is a 2D image.
Okay, two dimensions.
Okay? 2 dimensions.
Flat.
So it's just shadow.
Mm.
Okay, so a CT scan is a 2D image superimposed on one another. Meaning, it is a 2D image casted on top of one another.
Maron, like a crepe cake.
Yes.
If you have ever eaten a crepe cake, right? Like paper moon.
Yeah.
Yeah.
Or
One layer on top of another.
Yeah, one layer on top of another. Or it would be like your gardenia bread. Sliced,
sliced
your
bread.
loaf of bread, your sliced bread. So it's like that.
2D images, one on
2D
top of another.
images, one on top of the other. So what do you have? 3D image.
It becomes 3D.
Okay, it becomes 3D. So when you go to the hospital, there can be an option of 3D imaging CT scan. Okay, so the CT scan, the computer can actually create an image, a 3D image, so that it shows where the exact location of the tumors is. However, the 3D image is only shown to patients for educational purposes. The diagnosis, the doctors do not make their diagnosis using the 3D image. The doctors make their diagnosis through this image. This is how the doctors read the CT scan.
Okay.
Okay, it's a 2D image. Okay, they are seeing a cross section of that 2D image. Okay, so this is the brain. This is the normal scan or normal CT scan of a brain. This is brain cancer.
Oh, you can see that spot on the left, right?
So this is how a CT scan is created. Okay, so take a look at this banana. Okay?
Magic banana.
Now, this is how you look at a CT scan. So remember, when you go to a CT scan hole, you lie down, right? You lie down. Okay, so imagine this is your head. Oh, okay. Imagine this is your head, and this is your feet. Okay, so you lie down, right? You lie down, and then you go into the CT scan donut, right? Like so. Now, the scan would be how? The scan would be from the top of your head down towards your body. The doctors are actually taking a look at your body like this. Okay? So in your perspective, you would be looking at the patient's body like this. This is the head. Okay, remember, this is the head, this is the head, this is the feet. Okay, so they are looking through the patient like this.
Okay.
Okay, that is the perspective when you take a look at this image.
So
So now, where would your left and right be? Okay, so the right would be the perspective of the patient. So the right would be here. The left would be here. Okay, so when you take a look at this image, the white spot that you see here is the brain tumor. So the brain tumor would be at the right of the brain.
Okay,
right part
okay.
of the
Yeah,
brain.
I got it. From the feet.
From the you're taking a look at the patient from under him, from the feet.
Got it.
All right. So
what can we tell from this tumor?
So from this tumor, of course, this is around at the parietal lobe, no? Parietal around the occipital parietal lobe. It's around here, no? Now, take a look at the dark spot. So if you have a tumor, that will block the fluid inside the brain from circulating as well. So that can form hydrocephalus, that can form headaches, that can manifest motor and sensory deficits as well. Okay?
Okay. So that's
how
basically.
Okay, so that's what brain cancer looks like, right? So here's another CT scan of your liver. This is what a normal scan of the liver is. And this is liver cancer.
Oh, where's the tumor?
The tumor,
I can't tell, right?
The tumor is where the red arrows are pointing at.
Okay. All right. Okay.
So you have the liver, relatively.
It's a different color.
Yeah, it's a different color. Usually, liver cancer would tend to have a darker shade of gray. Okay.
All right.
So that is what it looks like. Now, for liver cancer, there is something that we call 4-phase CT scan.
Okay.
Or a CT scan with contrast. Okay. Now, why do we need the contrast? It's to highlight the tumor. Remember, the tumor has its own blood supply.
So you pump something in that can trace
it.
That will cause it to glow.
That will cause it to glow. Okay. So if it glows upon injecting the dye, then it is most likely a tumor.
Because it has blood supply.
It has blood supply, so most likely it is malignant.
No, you always said that cancer is odd shape. Is that what we tell also?
Yes, it's also odd shape. So as you can see here in the scan, the liver tumor is not a perfect circle.
So if it's, for example, if it's a benign tumor, it usually will be more round.
Yes, usually it will be more round.
Okay, so it's a bit oval, and definitely in picture B, it looks more broken up.
It's quite distorted actually already.
So that's how cancer tumor versus a normal tumor.
Right, so this is a colon.
Normal.
This is your colon, okay? Take a look at the liver. You have your liver above, okay? Then below, a little bit below, you have your large intestine.
Okay, Doc, please circle where the liver is. I have no idea. I'm very bad at anatomy. Okay, so that's where the liver is, all right?
This is where the liver is.
All right.
Okay. Then take a look at the, like the balloon shape, objects.
Okay, we are highlighting it on the image.
Right, that is your colon.
All right.
Okay, so it has a lot of air because there is bacteria. The bacteria are actually generating gas. That's why it has a lot of air.
All right.
Okay, so that's normal. This is what colon cancer looks like.
Okay.
Take a look at the image which is circled. The yellow circles.
Why is this one so dark compared to the first one, the normal? Why this one has lots of lighter gray and this one is so dark?
This is just a different slice. It's a different slice. It's a different cross section.
Yeah, different cross section.
Yes. Right. Okay. So that's why you see a lot of darker areas. Okay. Now take a look at this part of the colon. So this part of the colon is already in the descending colon. Okay. So take a look. Right now, the colon inside there should only be gas. Okay. However, take a look at the grape area. It looks like blocking.
It looks like this part. This part is like a bridge.
Yes.
Separates the two.
That is the tumor.
Oh.
Okay. Now take a look at the liver. Doc,
if you didn't explain, all this looks the same to me.
Yes, exactly. Actually, doctors usually have the same issues. They all look alike.
They look alike.
So, okay. Here's another thing. This patient actually has a colon cancer stage 4 with liver metastasis. So take a look at the liver.
I see some spots in the liver.
You see some darker spots, right? Those are the metastases.
Oh.
So remember, any tumor that is in the liver, whether it is metastatic or it is from the liver itself, in terms of when you under the CT scan, it would be shader with a darker gray. Okay.
Darker gray. All right, that's interesting.
Right. So here's another scan that we call as a PET CT scan. So PET means positron emission tomography. Okay. So it's a high-tech. High-tech CT scan. Now, usually with CT scan, we know the anatomy. We know the location of the tumor, okay, how big it is. However, we do not usually know its function.
Oh.
Is it metabolically active? Okay?
Okay.
Because there are benign tumors, right? So, in a PET scan, under the PET scan, the doctors will inject a dye, again, a contrast. Now, this contrast is made out of glucose, sugar.
Okay.
Okay?
So let me put it in layman terms. Normal tumors that are benign are not functioning. They're just like a mass, right? But a cancer is actually like a more like a living thing, right? So it has metabolic processes. Well, what Doc means is it has blood vessels, it's burning energy, there's movement in it, instead of just a clot of flesh, right? So now you insert glucose to see if anything,
If it uses the glucose.
if the tumor is using the glucose. So that's a PET scan.
Yes, that's a PET scan.
All
Now,
right.
what do doctors see, when they read the PET scan result? This is what they see. Okay, so the dark spots there are where the glucose went into.
Okay.
Right? So take a look at the top, at the head. Above, it's shaded super dark.
Yeah.
Because the brain mainly runs on glucose.
Wow.
That's
Okay.
why.
Okay.
Okay, so that's number one. Number two, as we go down, the thyroid, you can see the neck part, it is also shaded a little bit darker. The liver is a little bit darker, and then around the intestine, and especially at the bottom part where it is super dark. That part is the urinary bladder.
Yeah. So your bladder has a lot of sugar, or what?
Yes, because you pee it out.
Alright.
You
But how
pee
come
out
the
dye.
bones are bright?
The bones are bright because the bones don't the bones are not highly vascular, so they don't use sugar so much.
All
Okay,
right.
so they are just structures.
Okay.
So it would be the same thing with a benign and a malignant tumor. A malignant tumor will use more energy, will use more glucose, so it will uptake more glucose. So in a PET scan, that will look like a dark object. Okay, if it is a benign tumor, then it will look white because it doesn't have
nothing
any
is
uptake.
functioning in there.
Yes.
Okay, let's take a look
Now,
at a cancer.
Let's take a
PET
look at the
scan.
cancer. Now, what we do is we superimpose or we
Wow.
put the PET scan on top of the CT scan, okay, and see if the thing that we saw in the CT scan lights up. Okay, so this is what happens. So this is an example.
So
of
the picture
multiple-
A is that
this is a multiple metastasis.
all the dark spots are where the cancer has spread.
Yes, that's bone metastasis.
Wow.
Multiple
okay.
bone metastasis.
Wow, you can
Okay.
see. And so the rib cage here, these are all
Yes.
cancer
those-
tumors.
Yes. Okay.
cancer cells.
Those are all cancer cells. Okay, so that's what
Wow.
it looks like.
Okay.
Okay.
So for those of you out there who your doctor tell you to go for a scan and you don't know, or you've never done a PET scan, now you know why it's so important. It's so clear. It's so clear you can see, right? Wow. And what about B, C, and D?
So B, C, and D just shows you where the tumor is, no?
So this one lights up.
Yeah, this one lights up. So this is what I'm telling you. A CT scan, okay, then you put the PET scan on top of the CT scan and see if it lights up, okay? Then, lo and behold, the lighter area, so that is your prostate. So that is prostate cancer.
Okay, so that's why if you do a PET scan, it will come together with a CT scan. All right.
Okay, so that is together. Now,
MRI.
let's go to an MRI. Usually for prostate, the imaging modality of choice would be an MRI. Okay, so this is what a normal prostate looks like under the MRI. Now, what does prostate cancer looks like? So this is what it looks like. So an MRI is it just looks like a CT scan. However, the MRI would have a much higher
Resolution.
definition.
It looks clearer.
Yeah, it looks clearer. So here, as you can see, the whole nut-shaped thing here, the whole nut-shaped thing here is the prostate. Now, as you can see,
the darker
the
shade.
arrow, the darker shade, that is where the prostate cancer is.
Wow. After you look at more of these pictures, it becomes easier. But no, Doc, thank you for this particular session. It's quite interesting.
Okay. So yeah, another part of the body that is used that uses MRI, no, is the brain.
So this is a normal brain
It's
scan.
a normal brain scan under the MRI, and this is brain cancer.
Oh, it's
Okay.
so obvious.
It's so obvious, right?
It's so obvious. So
Yeah.
A, B, C, D, is it the same brain but different levels?
Yes, it's the same brain. Actually, this is this is the same brain. However, what you see is quite different, right?
Yes.
You can see picture A, the brain is colored gray,
Yes.
right?
Then B, you see a bright spot.
Then B, you see a bright spot.
Then C, it spread.
Yes, then C, it spreads. So those are just different MRI modes.
Oh, different modes.
Different
so
modes.
even an MRI, they can like switch resolution or
They can switch
mode.
resolution. They can invert the pictures to see a more detailed view of where the tumor is and its effect on its surrounding tissue.
Wow. So all of those, all of you who, very common questions. We have people asking us, should I go for the scan? So you can see how useful it is for a doctor. As you can see, it's so different and it's so clear, right? So I hope this encourages those of you who are maybe thinking that you didn't want to spend money on the scan, but it's so important that your doctor who's treating you get a clear picture.
Okay, now let's proceed to the ultrasound. So the ultrasound is a little bit more difficult, no? Because ultrasound is operator dependent. So if the operator was not able to catch the tumor, then you won't see the tumor. Okay.
Okay, that's
Right?
important to take note.
That's important to take
Ultrasound is dependent on a person doing the ultrasound on you. If he's not skillful, or he might miss the tumor.
Okay, so where do we commonly use the ultrasound for? Breast cancer. Okay, so here is the ultrasound of the breast. So this is what normal looks like. This is a benign breast mass. Okay, so as you can see here, you see two round dark spots. No?
Yes, two.
Okay, so what is it inside? So that dark spot is filled up with fluid, liquid. It's water.
It's water.
Okay, so water shows up a dark spot under the ultrasound. Okay, however, on the
extreme right,
on the extreme right, the last picture, that is malignant. So you can see the same round spot, no, irregularly shaped. However,
yeah, the shape is even weirder.
The shape is even weirder, and then inside that round oval shape, no, is a more distorted architecture of the mass. So this is malignant. So we call that a complex hyperechoic mass.
Doc, if you had the benign ultrasound result, would the doctor even suggest a biopsy?
No.
But if you had the malignant one, do you need a biopsy to confirm, or is it pretty obvious that it might already be cancer?
Oh, with just the ultrasound alone, it would already be pretty obvious.
So then would a patient still have to do for biopsy for breast cancer?
Yes, you would still have to do biopsy because we need to know the type of breast cancer you have.
Oh, that's true.
To determine the treatment.
Right, there are different types of breast cancer, and if your type of breast cancer is suitable for immunotherapy, you don't even go for chemotherapy.
That's correct.
Right. So yeah. Okay. So you still need to do your biopsies. All right. Okay, that's good.
Now another part of the body that is used. That ultrasound is preferred to take a look at is the ovary. So this is what the normal ovary looks like. Okay, you see the dark spots again.
Yes.
So those are ovarian cysts. Okay, so
that's
those
pretty common for women, right?
Those
Very
are your
common.
egg cells waiting to mature and pop.
Oh,
you know?
okay.
Okay. So that is quite normal, and this is what an ovarian cancer looks like. Again, inside the ovary is a fluid. It's fluid filled.
Okay.
However, you can take a look at the square. No, you see an irregularly shaped hyperechoic mass there. So it's quite gray with the same color as the surrounding tissues. So that is the mass. Okay, and upon further imaging, okay, if you take a look at it, take a picture, this is what it looks like.
Okay, so you can see it looks abnormal. So that center spot here should actually be pretty clear. All right. Okay.
So now, just a summary of what we have learned.
All right.
Okay. So for head and neck, the preferred imaging modality would be your CT scan, MRI, and ultrasound, specifically for the thyroid. For the chest, it's X-ray, CT scan, MRI, ultrasound. For breast, for the abdomen, it's CT scan and ultrasound. For the pelvis, okay, it's CT scan, MRI, and ultrasound. For any musculoskeletal structure, that would be your X-ray. For the bones, MRI for the muscles. Okay? For metastasis,
It's the
okay,
PET scan.
it's the PET scan, the bone scan, CT scan, and MRI, which is the best to determine. But preferentially the PET CT scan.
And we saw it just now. Why? We could see the metastasis of the cancer cells all over the body. Wow, Doc. Thank you very much. Well, this is a short course on how to be a radiologist. All right, but I hope today's episode gives you an idea for those of you who your doctor is requesting certain scans and imaging, and now you can see how helpful it is for your doctor. And we want to help our doctors diagnose us as accurately as possible. So without further ado, let's go to our AMA Ask Me Anything segment.
Good evening, everybody. Thank you so much for watching another episode of Simply Heal webinar brought to you by Simply Nature, your long-time running healthcare awareness webinar here in social media. I am very sure that you have learned a lot from the two gentlemen who discussed our topic for tonight, which is cancer diagnosis, taking actions on your diagnosis. Cancer imaging, taking actions on your diagnosis. So without further ado, to answer our questions for tonight. By the way, questions are still welcome, okay? I'd like to call on, first off, our CEO of Simply Nature and PPAR's expert from Singapore, Mr. Sean Lin, and of course, our lifestyle medicine doctor, Dr. Jansen Calalan. Good evening, Sir Sean, and good evening, Doc Jansen.
Hi, good evening, Sheila, and a very good evening to all our regular viewers, and a big welcome to our new viewers. So to our regular viewers like Lily, I have a sexy voice today, which is why I'm not there in the clinic with Dr. Jansen. So I'm coming live from my home tonight. So this is Shen with his sexy voice. I hope you guys found today's topic very interesting, and I still feel like, wow, it's so good to have Dr. Jansen here, because if I look at the X-rays and the CT scans, I still can't see where the cancer is. So Doc, back to you.
Yeah, hello Sean, hello Sheila, hello everyone who's watching tonight with us now. Happy to be here. So we can now start the AMA.
Thank you, sir. Thank you, Doc. Okay, the first question was sent to us privately by one of our clients. Can you explain the difference between cancer screening and surveillance?
Cancer screening and surveillance. Okay, cancer screening is when you are not yet diagnosed with cancer. So you are trying to catch cancer, or you are trying to diagnose cancer. Cancer surveillance is monitoring already. You are already diagnosed with cancer, and then now you are monitoring its progression. Yeah, so that's surveillance, basically.
Doc Jansen, the difference between cancer screening and cancer surveillance is, do you do different diagnose? Do you use different, equipment? For example, is a CT scan actually ever used for cancer screening, or is it most often used for only basically used for surveillance once you already suspect cancer?
Yes, basically we do use the same equipment, but depending on the purpose or depending on the goal, one modality would be more effective than the other. Okay, so for example, for gynecologic cancers, ovarian cancer, cervical cancer, usually ultrasound would be the best screening tool, best imaging tool to use for screening. Okay, but of course, to really screen, for example, for cervical cancer, the best screening tool would be pap smear. Okay, however, for ovarian cancer, like for example, you are feeling a discomfort over your abdomen, right? Then ultrasound would be the better tool. Okay, CT scan can also help, but CT scan would be more expensive for the same amount of information that you will need. Okay, so CT scan, yes, you will need it eventually, but CT scan, you will use it when you are already planning out the surgery.
Doc, just a quick, I guess, countdown of the common cancers and what's the most common type of screening procedure that people will go. I mean, for example, I'll start with one. Prostate cancer. When you're 50 years old, go for a prostate examination. That would be the standard screening that everybody will go.
Yes.
Okay. Then what about breast cancer?
For breast cancer, it's still ultrasound. That's the best
Ultrasound.
screening tool, yes.
So not mammogram.
Ultrasound and mammogram together. But you know,
Oh, okay.
sometimes there are women who are not qualified to undergo mammography because probably they are more flat-chested, or sometimes the anatomy isn't just feasible. Number two, it's really very uncomfortable for them to undergo the procedure. Okay. Number three can be that they are already feeling pain as well. So yeah, we go back to the question of comfort again. So sometimes,
How often for women, when should they go for screening? For prostate cancer, for guys, it's 50 years
Yes.
old, go for your prostate examination.
Yes.
What about breast cancer? When and how often? And and you mentioned it's ultrasound.
so women who are age at least 40, 40 years and up should already undergo annual breast ultrasound and mammography. Annual, okay? If you have a family history of breast cancer, I would even consider screening as early as 30 years old or 35 years old.
All right. Okay. So what about colon cancer?
For colon cancer, you start at age 50 for in the general population. Okay?
And you do a colonoscopy or
Yes, colonoscopy. That's the standard
colonoscopy.
one.
All right, colonoscopy.
So, colonoscopy in that sense is special because colonoscopy is both screening and then therapeutic. So meaning you diagnostic and therapeutic. So when the doctor inserts the scope inside you, immediately
Okay.
the doctor can see the polyp. Okay, once the doctor sees the polyp, okay, this is cancer. He can already excise it right then and there. So that's also therapeutic. They can already
Yes.
remove.
So the scope itself has like instruments for
Yes,
it to
instrument
snip
to-
off.
to snip off,
Wow.
yes.
Okay, that's good news.
Yeah,
So in 2 years I have to go for my very first colonoscopy.
Yes,
All right, I'll be
yes, yes.
50 in 2 years.
So
Okay.
yeah, that's for patients who have no family history of colon cancer. But if there's someone in your immediate family who are diagnosed with colon cancer, you have to start screening at least 10 years early from the age that he or she was diagnosed. So for example, if somebody in your family was diagnosed at age 53, for example, then you have to undergo colonoscopy already at age 43. Okay?
All right.
Yeah, and
Okay,
then,
so we
Yeah, that is
What are-
done every 10 years, every decade.
thank you. And did I miss any of the very, very common cancer? We have breast, colon, prostate. I think that's the most common. Lung cancer is basically unusual, right? You get lucky if you catch lung cancer because
Early, yes.
X-rays, right?
Yeah, X-rays,
Yeah.
chest X-rays. That's the way
But,
to.
but there's no there's no reason for a normal person to like go in for lung X-ray.
Exactly.
So it's not really a
Exactly.
screening.
Unless your company is sponsoring your APE, right? Annual physical examination.
Yes, I was about to ask.
Yeah.
When we do an annual physical examination, do they actually screen for cancer?
Well, not really. But
Okay.
for the chest, at least for the chest, you get a annual chest X-ray exam. So anything inside the chest that's growing, the chest X-ray would be able to detect.
All right. Thank you very much, Doc Jansen. I hope everyone you got at least for the very common cancers, you got a clear idea what are screening tools and when you should do it.
Thank you, Doc. Thank you. So, in other words, the X-ray is usually just a first level screening.
Yes, right, for screening. Yeah.
Thank you, Doc. Thank you, sir. All right, next question we have here. How do we prepare patients' body before scans? Like what foods not to eat or drugs not to take?
The only preparation that you would need is for yeah, fasting. That's it. For example, for whole abdomen ultrasound, you need to fast for at least 6 hours. For PET scan, yeah, I think you need to fast as well because once you go to the hospital, right, they would inject you with, or let you drink with a glucose drink. Okay, that drink is tagged with a radioactive tracer. Okay, FDG. So I think that's about it. But nothing in particular. If there are certain foods that are prohibited, not necessarily. For colonoscopy, well, there would be some bowel preparations that need to be done, right? So usually the gastroenterologist usually advises you on what to do. But it's basically to clean everything inside your bowel out. So you will poo everything before you go for the colonoscopy so that everything is clean.
Oh, Sir Shaman, you're on mute.
Doc, in terms of when we go for X-rays, like CT scans, X-rays, anything that has radiation, I remember that when I watched the Marvel movie Iron Man 2, Tony Stark was always drinking out of a green water bottle because he had radiation poisoning. So he was actually drinking algae because, and then I went to take a look. Yeah, it's true. Because algae absorb heavy metals and they also absorb radiation and pull things out also. So in terms of the viewer asked about preparation for scans, what about post scans? Like if you're going for X-rays, CT scans, is there anything good to like flush your system after that to give yourself a detox? Some people might be thinking, drink wheatgrass so that they get lots of chlorophyll, clean out the radiation. Any comments about that?
Well, the amount of radiation from the imaging machines is quite low. So even if I receive the same amount, even if I receive the same amount of radiation from the imaging scans, I wouldn't really worry about it. I mean, for the typical chest X-ray, you would need about 100 chest X-rays for you to reach the radiation poisoning level. For CT scans, I think it's around 25 in a year. So the threshold is really way up there. Okay, for imaging, but I would only consider considering such strategies, no, if you are someone who is working in a radiation facility, you're exposed every day to radiation, then I would consider detoxifying once in a while. Probably I would do it once a week. Okay,
all right,
once a week, yes.
Just for everybody's general knowledge, it is actually true. Industrial pollution, like for example, chemical factories and things like that. One way they actually scrub the air that they release back into the into the air, the smoke that they release back into the air, is they actually put them through microalgae scrubbers. They literally, let's say at some chemical factories, they actually run the gas or the pollutants through water with large they are very thick with microalgae, so that the algae actually absorb the heavy metals and take it out of the system. So it's very interesting just to let everybody know that algae are actually used to remove pollutants in industrial use. So you can also see how that could be why it's very detoxifying, and why this helps cancer patients who are undergoing, let's say, chemotherapy, radiation therapy. It also helps to pull the toxins and radiation out of your body from the general circulation in your body. So yeah, that's another reason why our protocols and PPARs really helps keep a patient strong when they're undergoing chemotherapy and radiation therapy. Without mentioning name, I just want to say that today I was talking to Dr. Jansen. I'm so encouraged, Doc. Patient A, we always mention her as patient A. It's amazing. I know her so well. She is such a warrior. I mean, she's really a warrior woman. Junie, I think you got to go and profile her for the Warrior Woman series. Yeah, and she had breast cancer that metastasized to the bones and the brain. Wow. When I caught up with her again, she was really so discouraged, and she was thin, but she was such a fighter. I mean, she had multiple tumors in the brain. Honestly, I was very encouraging to her, but in my heart, especially when it's a friend, you are you are hoping against hope. But the good news is she went, and this is again why in our program we talk about natural protocols, but yet we are often talking about chemotherapy and radiation therapy. And again, I want to state, Doc Jansen is a lifestyle medicine doctor. He's not an oncologist to purposely pushing chemo. He does not prescribe chemo. So how come viewers who come to our program end up hearing two persons keep talking about this chemo? Not because we love chemo or radiation therapy, because we love our cancer patients. We love you guys. And we just want you to have the best combination. So this is a case where patient A had aggressive multiple types of cancer, and it spread to the did it spread to the lungs, Doc Jansen?
No. Fortunately,
Just the bones and the
just the brain. Just the brain.
Oh, just the brain, sorry.
Yeah, just the
and multiple tumors in the brain, right?
Yes.
Oh, that's so scary. I mean, when you hear that something's growing in your brain, it's just how is she now?
When I talk to her, it seems that she doesn't have any illness at all. Well, she is bald, of course, but that's because of the radiation therapy that
radiation
she
and
received.
chemo, yeah.
Yes. So, but right now, no residual at all. Well, in the first scan, when she came to me, in her previous scan, the radiologist actually didn't mention any specific number of tumors that she had. It's just that it's numerous. That's it. But right now, her scan recently, the most recent scan that she had, she has only 3 tumors left. So that's actually more than 50% reduction in size and number of the.
Wow.
Yes, so that's really quite amazing. And all throughout her treatment, chemo and radiation therapy, she was working because she's the breadwinner. So she cannot stop working, okay? Because she had to pay for her treatment. She has to support her family, So it's really quite helpful with what we did to her. Yep.
Wow, so encouraging, and I'm really proud of her as a friend and also as a cancer warrior. That's a good encouragement. So to anyone who is viewing today, wondering what you can do to make yourself successful in your fight against cancer, book a consult with Doc Jansen. And especially if you are already scheduled to go for chemotherapy, radiation therapy, you've heard how Doc Jansen's, my friend patient A, did so well with Doc Jansen, and she had tumors metastasized to her brain. So thank you. Sheila, next question, please.
Thank you, sir. Thank you, Doc. Okay, another question that we have here. Okay, what does BIRAD mean? BIRAD or BIRAD mean?
Okay. BIRAD is for breast. That's a scoring system to know if what you have is benign. Is it malignant? Is it probably benign or probably malignant, or is it confirmed cancer? Okay, so the BIRAD system actually have 7 scores, BIRAD 0 to 6. Okay, BIRADs. Wait. Okay, so let me just show you the resources. Okay, so you have BIRADs 1, 2, 3, 4, 5, and 6. So 7 categories all in all. So if it's BIRAD 0, for everyone's information, if it's BIRAD 0, then more information is needed. So additional imaging like mammogram or ultrasound is needed. Why is it so? Probably the ultrasound machine at that the present ultrasound machine has some defects or has some artifacts. It wasn't calibrated properly, so imaging is quite blurred. Okay, that's why it's BIRAD 0. Okay, if it's BIRADS 1, then it's benign. Okay? If it's Byrod's 1, it's negative. Okay? So normal breast tissue. Okay? Byrod's 1. If it's Byrod's 2, then of course we now see something, but it's benign. Okay? Like a breast cyst or a breast fibroadenoma or okay? So there's just a tumor there, but it's benign. Okay? Okay, excuse me. For Byrod's 3, it's probably benign, so it's something somewhere in the middle. Byrod's 4 is already suspicious for malignancy. Okay? Now, what is the difference between this? Because this is the gray area. Okay? Remember, back in our past webinars, ultrasound characters of tumors have there are specific ultrasound characteristics of benign and malignant tumors. Like for example, if what you see on your screen is if you read your ultrasound report, if the radiologist says there, it's hyperechoic. Okay, hyperechoic means that the tumor is reflecting a lot of sound. Okay, if it's so, then the tumor might be complex. If it is complex, then it might be malignant. But it's not yet definitive. Okay, because a benign tumor can also be such. Okay, so the radiologist will now put there, okay, it's Byrod's 4, this is suspicious for malignancy, you need tissue biopsy. Because the radiologist is not sure, because it's hyperechoic, but then it's really round. Okay, so very regularly shaped tumor is also a sign of it being benign. Okay, so if it becomes Byrod's 5, okay, highly suggestive of malignancy, then there will already be physical exam characteristics already. So, for example, on the breast itself, no, the radiologists see there are skin changes, there are already ulcerations on the skin. Then that the radiologist will put their Byrod's 5 category. Or if in the mammography, you know, if in the mammography there are spicules, there are a lot of calcifications, then the radiologist might put their Byrod's 5. Now I'm speaking too medical already, but that's how they decide, no? Then Byrod's 6, the last one, is a known biopsy-proven malignancy. So you already have biopsies showing that or telling you that it is cancer. Okay, so that's what Byrod's is. Okay. Now there are other, for the other organs there is also such a thing. Okay, so for the prostate it's pyrads, for the thyroid it's thyrads. Okay. So
it's different in different organs.
Different organs, yes.
That's pretty cool. Oh, sir, you're on mute.
No, I said I like Sheila how you went, oh. Okay.
Thank you, Doc. Thank you, sir. Okay, so the next question that we have here coming from Serena Tan. Doc, how often go for CT scan for appendix cancer? Diagnosed for 2.5 years. Last CT scan done on September 21.
Depending on where you are already right now. If you are still undergoing treatment or about to undergo treatment, then the oncologist can request as many CT scans as you want. Okay? Because if you're about to undergo procedure, then more information. It's in the best interest of your doctor to have more information. But if you are already done with your treatment, then usually it's about every 6 months. At least for the first few years of monitoring. Then if you are already on remission, then that would be probably a once a year scan would be enough.
So actually there are two answers to this. One is for surveillance, which is what Doc Jansen said, every 6 months, right, Doc? The other one is another reminder to everybody, since today we are talking about cancer imaging, when do you do diagnostics? We do diagnostics because we are looking to see if we are going to make changes to the way we treat the cancer. For example, deciding whether to increase your chemo dosage, whether to continue the chemo or to reduce the chemo, or whether to do surgery. So basically, anytime your doctor is thinking about making an adjustment or whether he needs to make an adjustment to your treatment, that's when you do a diagnostic. All right. So apart from that, it's just the surveillance. Yeah.
Thank you, sir. Right. Just before we go to the next question.
I hope that's helpful, Serena. Yeah.
Yes. Thank you, Ms. Serena, for that question. Just before we go to the next question, Ms. Janelle, one of our customer relations officer, want to greet her patients, Mr. Ramiro Ramirez.
Oh, wow. Okay.
Very, very sweet. Okay, another question coming from Ms. Emerenchana Garcia. Doc Jansen, I'm Emerenchana. I had ultrasound, whole abdomen ultrasound, and they saw in my uterus 3 I think 3 cm.
3 centimeters.
Could you please
That's 3
clarify?
centimeters. Yes.
Yeah. Uterine myoma. What could it be? Is it already a cancer?
Not necessarily, because again, for ultrasound, a benign tumor and a malignant tumor can look the same. Okay, especially if it's a uterine myoma. But if it's uterine myoma, okay, it's usually benign. More often than not, at least 95% of the time, it is benign. Okay, but however, there are certain rare types of myomas which can become malignant or cancerous. Okay, so if a uterine myoma becomes cancerous, then that is already called as leiomyosarcoma. Okay, but don't worry, because this one usually 3 centimeter myoma, especially if it's solitary or alone. No? If it's alone, then usually it's just benign. And do you need? Would you consider having this removed? Probably yes. If you're already if you're bleeding, if you are having symptoms like abdominal pain. If it's really quite uncomfortable, you are every menstruation you are bleeding a lot. In what situation would it be better for you to just wait it out? Number one, if you're not feeling anything anyway, and number two, if you are about to go on menopause, then usually myomas resolve on its own after menopause. Okay.
You're muted, sir.
I thought that was good to know that after menopause, myomas sometimes clear themselves. Doc, that was a very comprehensive answer. I think I really hope the viewer got what she wanted. I can't think of a more comprehensive answer. Yeah.
I think she was also a bit relieved.
And I noticed there's Mr. Vale Nathan, if I remember correctly. He first joined our program and had questions regarding a loved one of his, a child, if I'm not wrong.
Correct, yeah.
Yeah, oh, okay, good. I remember correctly. I hope all is well with his son, right? Is a boy, if I remember correctly. Yeah.
Oh, thank you, sir. Thank you. Oh, by the way, because we were mentioning about screenings a while ago. Is there like a consideration or age consideration for women to like screen if they have myomas or anything like that?
I would own to screen for myoma. Not really. Usually, myomas get diagnosed incidentally. So, you undergo ultrasound for another reason. Okay? And number two, well, you already have symptoms. Then, that's the time. Usually, symptoms of myoma would include abdominal discomfort, abdominal bloatedness that doesn't go away, or excessive bleeding during menstruation. Or intermenstrual bleeding as well. In between menstruation, you have spotting. Okay?
Thank you, Doc. Okay, so we have another question privately sent to us. You go. Okay. Why is creatinine test always necessary before going to CT scans? And is it only for CT scans?
No, no, no. Okay. There are two types of CT scans. Okay, you have your contrast enhanced CT scan and your non-contrast enhanced CT scan or plain CT scan. Okay, so the only time you need creatinine clearance is for contrast enhanced CT scan. Why? It's because the contrast can damage the kidneys. That's why your nephro or the radiologist want a clearance first, just to have an idea, just to know, no, that your creatinine is normal or your kidney is functioning well, because the contrast is also eliminated or excreted through the urine. So that would be through your kidneys. So if you have an elevated creatinine, meaning your kidney is not functioning well, then the radiologist might think twice or ask you to go back to your doctor to request for another imaging study, because then you would have a very high risk of getting your kidneys damaged by the contrast. Okay, so that's the main reason why we request for creatinine always before you undergo a contrast enhanced CT scan. However, for the plain CT scan, you don't need any clearance for that. You can just go to the hospital and have it done. Okay?
For plain CT scans, do patients need to go for fasting or both? Whether it's contrast or plain, they have to go for fasting.
Good question. Wait. For CT scan, for the plain CT scan, yes, you need to fast if they will scan your abdomen. Yeah. You need to fast if they will scan your abdomen. That goes for both contrast enhanced as well. Okay. Yeah. If they will scan your abdomen, if you're going for a CT scan for the chest, for the head, for example, you don't need to fast. Okay.
Thank you, Doc. Coming from Miss Lily Dumio, our favorite viewer, so say, Doc Jansen, my mammogram result is BIREDS 2 for right, 6 for left breast. How to make sure the right breast do not become cancerous?
Okay, good question. Okay, Miss Lily, you follow everything that we have discussed during our consult. Okay, because that is already preventing it from, that's already prevention. But considering your age, I think your right breast will be fine for the rest of your life. But of course, you have to live healthily, eat healthily, to prevent it. To prevent your right breast from developing a tumor later on. Okay, so just do what the things that we've discussed during the consult. You'll be fine.
Thank you, Dr. Jansen. All right, another question. What is the best way to improve my creatinine?
Best way to improve your creatinine is to drink a lot of fluids every day. Okay.
Fluids does not include soft drinks, right?
By fluids, that's water. Okay, so that's water. Okay, that's not including your tea, your coffee. Okay, that's just water. At least, okay, for those of you viewers who are living in tropical countries near the equator, that would be 10 to 13 glasses of water every single day. Okay, 10 to 13. So always make sure that your urine is colored. The urine color is clear. Okay, don't even allow it to be tinged yellow. Okay, because if it becomes yellow, then you're lacking water already. Alright? But that is considering that you're not taking any multivitamins or supplements, okay? Because certain multivitamin supplements out there can make your urine turn yellow, okay? But that's the rule of thumb.
No, I use a rule of thumb which I learned a long time ago, that you don't drink enough water if after 4 hours from waking up in the morning, your urine is not clear. So if you wake up at 8 a.m. by 12 noon, your urine should be clear. If it's not clear, then you are not drinking enough water.
Yes,
Is that a good rule of thumb?
Yeah, I mean, if that works for you, right? That would make sense actually. But me personally, I use a more strict criteria. Yeah. So every time I urinate, I make sure that it's clear. So if it's yellow, I drink 2 glasses of water immediately after urinating.
Wow, wouldn't that make you want to urinate again very soon?
Yes, yeah, very soon you'll urinate again. So when you urinate, that should be clear already. Then after urinating, I drink about a half glass of water.
You know, since we talk about drinking water, I've met a lot of different beauticians. Okay, beauticians, those who are in the beauty industry, they actually are very specific on how you should drink water. Because having nice looking skin for men, if you are one of those people who read gossip columns or whatever, the single most recommended, I guess, cosmetic for men is actually for men to just have good skin, moisturizer. We don't have to use any foundation or anything. Just moisturizer will make a big difference. Because our skin is 9 times thicker than a woman's skin, I think something like that. So we just need to moisturize it. However, when it came to drinking water, those in the beauty industry always stress that you don't drink it like gulp, but you have to drink it in sips, so that the water is actually absorbed in your body and not just flushing through your system. So you know how guys usually drink water after sports, and you will notice, I used to do that because I'm in the army. So they will do this thing called a water parade, just so that we don't pass out under the sun. They make us drink 3 liters of water in front. Everybody just stands in a line and drinks 3 liters of water. You don't have to wait half an hour. Immediately after drinking it, you are rushing to the toilet to wee-wee. So I think something to take note of. When you're drinking water, you want your body to also absorb the water so that it can be used and to flush out toxins, and you're not just flushing your gut and to your urinary tract. So don't just drink in gulps. Take time to sip your water, drink it mouthfuls at a time. That will allow your body to absorb the water.
Thank you. Those are really good tips, most especially for household, for moms out there, in terms of monitoring. They see who goes to the toilet, and if they see, it's yellow, someone is not drinking water.
That's true.
Something like that. It's best to teach the kids earlier. Okay. Oh, we're talking about water, and a question privately was sent to us about it. Is alkaline water better?
No comment, Doc. No comment.
Okay, here's the thing with alkaline water. Our stomach produces acid. Okay, no matter what you do, your stomach is designed to produce acid. Okay? Now, if we drink alkaline water, the alkalinity of the water will just be neutralized by the acidity of the stomach. So no matter how alkaline the water that you drink, once you drink it, that will turn acidic immediately to the level of the pH of the stomach acid. Okay? Now, I'm not saying that it's useless, okay? Because if you have hyperacidity, or if you have stomach ulcers, for example, or then I think alkaline water would have a role. But this is just a guess, okay? This is just a guess. Because somehow, if you drink alkaline water, since it's alkaline, that can lower the pH of the stomach acid. Yeah, lower the pH of the stomach acid somehow. But again, the stomach acid, the pH of the stomach acid, or the acidity of the stomach acid is so acidic that
even with alkaline water, I don't think it's enough to neutralize it. Okay? Because once you drink water, okay, water just passes through the stomach. It doesn't stay for a very long period of time. Okay, it's unlike food, because with food, that will really stay inside the stomach for quite some time before it goes to your intestine. But for water, it just passes onto the stomach down to the intestine quite fast. Okay, so I don't know if the alkaline water would be really effective, you know. So well, personally, me, I don't drink alkaline water. I don't think it's really scientific at all. So I just drink normal, regular water, and then that's it. As long as it's clean, it's filtered, and that's it. Okay. Yeah.
Thank you, Doc.
For the person who asked this question, good thing that you see we do this program, there's more than one person, right? So I actually spend a lot of money on my water filter, right? So I mean, I have a Kangen machine, all right? So my friend did a one-on-one exchange with me. I gave him pipa tablets, and she gave me the Kangen machine. So I got a good deal on that. All right.
Yeah, you're right. I mean, I just want to highlight that point, right? If you want to invest in your water, go for the more sophisticated water filtration, not the alkaline water. Okay? Because an alkaline water with a regular or a poor filtration system would be still dirty, or would still be harmful to you, because the filtration system is sorry for the term, it's shit. Okay, but if you have a good filtration system, even if it's not alkaline water, then that would be great because it's clean. You know, it's clean, right?
Yeah, and there's actually, this topic is actually something quite interesting, because when you talk about water, I actually researched, you know, the best natural water in the world is actually generally recognized as Avion. And one reason is actually Avion's water clusters are actually smaller. So as Doc Jansen says, water just flushes through your system. So if the water clusters are smaller, there is higher or more effective absorption. And it's very interesting that Avion is just naturally, the clusters are smaller. You know, when there are other filters where they actually put a certain frequency into the water as well. Those are all rather interesting. I wouldn't say that they are not scientific, but I would say that their science is not usually in the conventional stream. But it's very interesting because most of these gadgets, the science is in physics actually, and not in medicine, because me and Doc Jansen talked about this before. Doc Jansen is actually like a physicist. Did you guys know that? Because if you know, right, medicine, you have to take I mean, depending on which country you're from. In Singapore, you go straight into medicine. In US-based systems, you have to have a basic degree first before you take medicine. Medicine's an advanced degree, right? So Doc Jansen is actually a physicist. He's Sheldon from Big Bang Theory, right?
Yeah, I took pre-med physics as my undergraduate degree program. Then went to
Doc, you know, it's very interesting that they realized that people, you know, those springs, or you know, those places where they have this legend that the water has healing properties. Surprisingly, the people who did a lot of research on that is in Eastern Europe, like the Russians. And the Japanese do that a lot too. So that they found out that the frequency of the water is different from those of us in the city. So apparently the frequency of the water, how it resonates with your body cells, does have positive alignment and gives you health benefits, right? So that's more into the physics approach to the concept of water. We digress. Let's go back to the original questions. but you know, every time, to all the viewers, every time we talk about something that is interesting to you and that you want us to continue, please type in and let us know. Because we also don't want to just answer cancer questions. We want something fresh as well. So if me and Dr. Jansen ever talk about something that off topic but is interesting, let us know so that we can continue if that interests you. All right, yeah.
Thank you, sir. Thank you, Doc. Okay, question from Dolly Kalubad. Can a cancer patient eat shiratake rice and keto flour and almond flour?
Shiratake rice, let me double check. Shiratake rice. So, one question at a time, okay?
Okay, I will answer another question. Let Dr. Jansen check out.
Okay.
Wait,
So while Dr.
let me answer Lily asked about reverse osmosis water. All right. I think all the general filtration systems are fine. Okay. They are better than drinking tap water. It is actually in general better than drinking bottled water because, to the horror of horrors, even Avion has plastic bits in there. They tested even the expensive Avion because of the bottling process. They have little bits of plastic in there. So drinking bottled water is actually not great for you. If you drink that every day for 20, 30 years, you might have, because plastics don't leave your body, they just keep accumulating in your body, right? So that's not going to be a good thing. So yeah, I think it's always, for me personally, if you have the money, or let's say your priority when you buy a house and you equip your house, one of my priority is to get a good water filter before you get a television set. Okay, because you drink water all the time for your cooking, for your kids, when you're sick, when you're healthy, and you drink so much of it. That and the air filter, the quality of your water and the air that you breathe, these are like the two biggest things that can affect your health. So if you don't live in a country where the water is very clean, which is most countries, then I think investing in a water filter is not a bad choice. Just make sure that you do it within your financial. You don't need to buy those like $5,000 water filters, but if you can afford, go ahead. No problem. But I think get a good water filter, one that is a good investment for your health.
That's a good point. Filipinos are always just buying packs, blue cans of water or gallons, right?
Yeah, those are plastic. There are lots of plastic bits in them. It's gonna build up over the decades. Yeah.
Benson, are you right?
Yes. Okay. Everyone who are on your computer right now, or you have the capability of to do a Google search, I'm going to teach you on how to know if the food item is okay to eat or not. Okay. So if those of you who are able to go on Google, please follow my instructions. Okay. The question that was asked is rice shirataki okay for cancer patients? Now I use a guide, which is called the total carbohydrate to fiber ratio. Okay, to know if the food item has sufficient enough fiber for a cancer patient to eat. Okay, and as a rule of thumb, I want an answer to be less than 5. Okay, if the value that we get is less than 5, if the carbohydrate to fiber ratio is less than 5, then the amount of fiber in the food item is sufficiently enough. Okay, so please Google rice shirataki nutrition facts. Okay, once you Google that, okay, go to images. Now, under images, just below the first figure that you will see, that's by rice shirataki konjac.jp. Konjac.jp, right? Click on that nutrition facts. So you should now see the nutrition facts of the rice shirataki. Now click on the image, so that will direct you to the website of Ishibashiya. Okay? So I think this is a noodle made out of rice shirataki. Right? Now, go to the nutrition facts, then you should see, under total carbohydrates, you should see 5.6 grams. And under dietary fiber, you should see 1.7 grams. Now, put out your calculators. Okay? So, divide 5.6 by 1.7. Okay, you should be getting an answer like 3.29. Okay?
Yes.
So, 3.29 is less than 5. Then, this food item actually has enough fiber in it. So, I would say that yes, this is okay for cancer patients. But, eat them or eat it in moderation because this food item is a moderately processed food item already. This is devoid of any nutrition at all. It has no nutrition anymore because it's already moderately processed. Look at the ingredients. It's yam flour, rice flour, pumpkin, and calcium hydroxide. So it's basically, moderately processed already, okay? There are no plants that's called yam flour or rice flour plant or rice flour tree, right? So that is processed from the whole food, which is yam, or the whole grain, which is rice. Okay? So for me, yes, it's okay for you to eat this, but you have to combine this with other whole foods. Okay? Yeah. So that's how you choose, how you know, or at least you know how I choose whether or not, how I determine whether or not the food items is okay or not okay.
Very helpful.
Yeah.
Thank you, Doc. Very helpful.
Yeah, Doc, it's so interesting what you say that this noodle is made from flour and a food came to my mind, something that I think Lily, our viewer from Malaysia, is able to get in her town, which is the Chinese thing we call a 算盘子. It's actually by the 客家人. It's a people group or Chinese people group, right? So they take actually yam, they boil it, they mash it up, and then they do put a little bit of flour in there, and then they make it into like little abacus, like gold pieces on the gold chest, right? Yeah, and then of course they use that as like the basic, like your pasta, right? So when I think about that one, that you seldom see that anywhere in Singapore anymore because it just takes so much effort. It's not flour. You have to get real yams, boil them, mash them, and then
wow.
And then you put some flour in so that it sticks together and it's more smooth, right? More glutinous, but it's at least 50 to 70% actual like yam.
Wow.
So that's the big difference. I as you talked about the pasta that we eat at restaurants and everything that is nutritionally quite empty. I suddenly realized, yes, because these are made of flour. But when I think of the 算盘子, the way they make it, wow, it must be nutritionally still so good, right? Yeah.
Yep. Now that you mentioned on how they made it.
Oh wait, sorry, just a comment. The thing that I can think of in Filipino food is kare-kare done the right way. I heard that a kare-kare done the right way, you think malakit rice, right? And then you have to cook it and actually grind it, not put thickeners. You actually use malakit rice and you grind it, and that's the proper way to do a kare-kare. All right, yeah, go.
Yeah. Okay, I forgot what I'm going.
I'm so sorry. Kare-kare is so delicious. Is it?
Yeah. About that 算盘子. That is the way they make it. That is minimally processed. Okay, we have levels of processing, right? We have the whole foods, which are the unprocessed and unrefined version of the food. So imagine an apple, then that is the whole food. Okay. Now if you from a yam, the yam is the whole food. Now you turn the yam, you mash it, and then you make noodles out of it. Okay, then just put a little bit of flour. That is minimally processed because you are actually not taking anything out of the food. You're just altering the physical appearance. So it's similar to a smoothie then, right?
Yeah.
If it's
a smoothie is always better than what's that called? Juice.
Juice, yes.
because juice, you take out the pulp,
The pulp.
you take out the fiber, you take out everything. A smoothie, you put the whole fruit in and you blend it, right? So you eat the whole thing. Yeah.
Thank you. Thank you, Doc. Thank you, sir. All right, quickly, there's another question about water. Coming from
Okay.
Mr. Ramir. How about the half teaspoon baking soda dissolved in glass of water?
Oh, that's interesting.
Baking soda is alkaline, so that would be just the same as alkaline water. Baking soda, um, it's okay if you have hyperacidity. So it's similar to taking in Gaviscon.
Maybe another way to ask this, because is it harmful to do it?
Is it harmful to do it? Not half a teaspoon would be okay. Half a teaspoon is okay.
So there you go.
Yep.
There you go. So if you are a firm believer of baking soda, go ahead. It's not harmful. So we won't have to debate the benefits of baking soda being taken in this way. Yeah.
Thank you, sir. All right, another question. Can arthritis or infection be also seen on imaging?
Come again?
Can arthritis or infection be also seen on imaging?
Yes, especially X-ray. Osteoarthritis is diagnosed on X-ray. Yeah. So that's arthritis. Okay. Infection, definitely yes. We can see infection in imaging studies as well. So that would be like your chest X-ray. Of course, chest X-ray, we can see pneumonia. So especially for COVID, right? So we see COVID pneumonia. So we can definitely see infection. For the other imaging modalities like your CT scan, your ultrasound, definitely yes as well. So for those the more uncommon ones like liver abscess, CT scan would be the modality of choice. For those who have a brain abscess as well, CT scan would be the modality of choice to diagnose that. Infection, where else? Diverticulosis, diverticulitis, we also use CT scan. Diverticulosis and diverticulitis, that's the inflammation, the outpouching along the colon or along your intestine, no? If that bursts, then you can develop infection, intra-abdominal infection. So imagine your poop emerging, or is it the proper term? Emerging or escaping out of the colon, right, into your abdomen. Okay, so that will of course lead to infection as well and eventually sepsis. You can die from it actually. So what else? Infection. Yeah. So that's about it. I think those are the more common ones.
Thank you, Doctor. Sir Van, can we go to the next question? Okay, so the next question, this is interesting. Can breast implants get in the way?
Come again? Can breast implants?
Oh wow. She's frozen. Let me guess her question. Maybe can breast? She made me think about a few questions. Number one, can breast implants cause cancer? If you have breast implants, does that affect like chemotherapy, radiation therapy? If you do radiation therapy, you'll be sending radiation to the breast, right? So does it affect chemotherapy? Does it get in the way of surgery? Probably yes, because that's where the tumor might be. But I think the first question is, does breast implants actually increase your risk of developing breast cancer?
Breast implants is only associated with breast cancer. Associated.
Okay.
But in terms of increasing the risk, wait, let me think. Because in general, because if you go on the internet, try to Google breast implants and cancer, you would find that the authorities are divided. Okay, so a lot of the authorities will say that yes, it has a link, but on the other side, no, it doesn't have any associations or any increase in risk. So
how do you decide then which to believe?
Doc, this is actually also very related to, for example, should you have a tooth implant? Should you have a bone replacement, a hip replacement implant, right? The idea is that you have a foreign body, a foreign object inside your body, and that would always cause irritation. I mean, the body would just try to get rid of it, right? So, and that's where we will think if the body is constantly irritated, it's always like interacting with that foreign object. And that's where we think cancer
comes in.
Because it's an irritation. So in that interaction over time, it's like rolling the dice. You roll the dice very, very often, you really might end up with a snake eyes, right? Double ones.
Exactly.
Yeah, so but then again, people have hip implants, people have tooth implants. So yeah, what's your view on
the question is the material that they use. For the breast implants, really it's divided in the internet, but I would consider it with what Shan said. Okay, that's how I would consider things. So do I really want a breast implant? Do I really need it? So those are the questions that you need to consider. Okay. On the other hand, for hip implants, for knee implants, so for those patients who really need total knee replacement, total hip replacement, then it's okay, because weighing the benefit versus risk. Okay, the benefit is on your side. Because then, if you have your deformed knee or deformed hip replaced, then you would get another chance of walking straight again, right? So that's how I would consider things. But in terms of getting cancer, for the knee and the hip implant, again, it's divided.
Wow.
It's divided. So I would now weigh things not on the cancer. Okay? I would weigh things on, do I really need it? If it's just for vanity,
we avoid it.
Yeah,
unless your livelihood depends on it.
Yes, unless your livelihood depends on it, right? So that's how I would consider things. But if you are someone like, I just want to get breast implants because I want to look sexy, but I don't really need it at all, my livelihood or my income doesn't depend on it, then why? I mean, why? You'll just feed your vanity, right? But, well, to each his own, right? So, I mean, if you are someone who really wants to go for that, then go for it. So, yeah, that's how I would
so I think the answer is there's no absolute certainty. So there are people who say it won't cause, but yet there is the understanding and the concept is very easy, right? Imagine if you have a piece of chicken stuck in between your teeth. After a while, it's just gonna keep irritating you, right? And then later it gets swollen, it could get infected, or it could just be okay. So that you just have to make a decision, but at least you understand why it could contribute to the creation or the development of cancer. Again, cancer is not caused by one thing. It has a combination of many things together. So imagine you always brush your teeth and you keep the rest of your mouth very clean all the time. So even if you have food stuck in between the teeth, it's not going to cause an infection. But if you're a person who doesn't brush his teeth, just a little bit of food stuck between your gums, you're going to have a serious mouth infections, right? So it's not just one thing, so take that into consideration. Doc, but the important question, does it affect chemotherapy? Does it affect radiation therapy?
Radiation therapy, yes. Chemotherapy, no.
Okay, there you go. All right.
Thank you. I think this will be our last question for tonight. But don't worry, like we always do, for those questions that we weren't able to answer tonight, we'll get in touch with you. Okay. All right. So let's go for our last question for tonight. Okay. Do I need cancer imaging if what I have is skin cancer?
Yes. You definitely need cancer imaging, because we will need to know if there are already metastases inside your body. Melanoma can metastasize inside your body. Okay? So, yeah. So, yes,
so that would be
definitely
the
yes.
reason why your uncle would call for an imaging, all right? So it may not seem to make sense, but yeah, I think it's I think this is why our sessions are so good. So I think I realize many patients, our doctors never get to explain to us why they want us to do certain things. So at least you can ask questions here. So, with that, I want to encourage everyone to please share our program. We made a commitment every Thursday night, rain or shine, sore throat or no sore throat. We try to be here, all right, to answer your questions. And when we see really critical questions, like I'm so glad Mr. Vail Nathan is with us. I assume that when he first dropped in our program, he heard something, he learned something that made it worthwhile. So please share with your loved ones and friends and family. And since I mentioned Mr. Nathan's name, then I'll just answer that. Apple cider vinegar, 1 glass of water every morning. Yeah, I think I used to do that until I got lazy. So I used to do that until I got lazy. So if you can make it a routine, all these are just these are all just very helpful living lifestyle, right? You're not like drinking half a bottle of apple cider. You're just putting a little bit, drinking early in the morning, probably just 1 teaspoon or 1 tablespoon in your water early morning. Yeah, all these are very simple practices, which are, I think, pretty good. And I think online you can see many benefits already. But don't take things into extreme. One of the things that I was very surprised, and after that, I was at first wanting to do more research, was when Doc Jansen told me kimchi is not good for cancer patients. Maybe because I watch a lot of Korean drama, so I want to believe that kimchi is a healthy food, right? And the Koreans seem to be very strong. They are very aggressive people. So maybe the kimchi should be good, right? It's probiotic. But when Doc Jansen gave me the statistics for what's that? Was it stomach cancer?
Yeah, top causes of death in South Korea.
Is
yeah, usually the cancer is gastric cancer, colorectal cancer. Yeah.
Oh, then that is pure evidence of what Dr. Jansen was telling me, that kimchi has many benefits, but the nitrate levels are simply so high. Which doesn't mean that probiotics are bad. It just means that we look for another source of probiotic that doesn't have the drawbacks of kimchi. Right? So these are the things that I'm glad we can discuss and help you with. All right. So I think the apple cider thing, I think it's a good. Doc Jansen, nothing bad about apple cider, right?
Apple cider can help me. It can help you lose weight.
Oh wow!
Yeah,
see, makes you look good too.
Yeah. So there's actually a study about apple cider. The researchers have had 2 groups. No, they fed them the same amount of calories, the same amount of food, but one group had apple cider. So the other group who had apple cider actually lost weight.
Wow. Looks like I'll start drinking apple cider in the morning.
Apple cider. How much apple cider do you need? 1 teaspoon or 2 teaspoons. That's about.
Oh yeah, and it's actually pleasant to drink. It's not bad. Because when I wake up in the morning, I know the best thing to drink in the morning is water. But I guess I just want something of a slightly stronger flavor in my mouth to like wake me up, right? So that's a good choice. I normally just put lemon juice. That's another choice. All right now, my wife makes me drink celery. I blend raw celery with a little bit of ginger. Yeah, it wakes me up.
Thank you, Sir Sean. It's a good tip because some of our patients before they go for surgery, they really have to lose weight. So
okay, that's a good tip.
Okay. Of course, just before you say goodbye to our dear viewers tonight, very quick parting words for them. Our topic once again is cancer imaging, taking actions on your diagnosis. Okay, starting off Sir Tan first.
All right. I hope you realized like me tonight that I'm not cut out to be a radiologist. I can't see the difference in many of the scans. I think for many of our viewers, I hope I'm not the only one, okay? But maybe some of you are talented doctors in the making, all right? So yeah, again, I think just a reminder, diagnostics and imaging is used because your doctor wants to make a decision to change your dosage, to try another treatment. So, try not to avoid it. I know if it's called for, understand there's a reason. I think it's a perfectly good question to ask your doctor. Doc, why do you want me to do this? All right, I think because doing an imaging costs money, especially MRI scans, CT scans. So it's good to be honest with your doctor. Doc, my budget very tight. Do we really need this imaging? Could you let me know why we are doing this imaging? Don't be afraid, right? Ask your doctor so that you have greater clarity. For those of you who, at the end of the day, are still shy to ask your doctor, then you can ask me and Dr. Jansen. Right? So we'll let you know why your doctor did that. So please, again, share our program with other people so that they can ask questions. They can be more comfortable asking questions on a program like this where they are more anonymous, or because Dr. Jansen is handsome and I look friendly, so it's easier to ask us questions, right? Yeah. So we always thank you for always joining us on our program. Please share. I will see you again next Thursday. Dr. Jansen.
Yeah, I actually concur with what Shan said. So usually imaging is one of the things that patients get or shy away from because it's an added expense. Okay, and usually scans are quite expensive as well. No, to be honest. So of course you have to talk to your doctor. No, if you are really tight with your budget. Ask them, is there any other alternative? Why are you requesting for this scan? So ask them, okay? So you will understand why it is needed, or are there any alternatives to it? Do we really need it now, or can we postpone it even? Okay, so those questions only your doctor can answer you. In order for you to make a sound decision, you have to consult with your doctor to make a sound decision. So don't just go during consults, okay? Don't just go to your doctor and then ask them, okay, what treatment what happens next, okay? How do I get well? Okay? Don't just go into that because you have to understand the disease. You have to understand what's happening inside your body. You have to understand the treatment plan that is given to you. Okay, why are they requesting for this? Why are they requesting for that? Why not that imaging modality? Why not that treatment? Okay, so don't hesitate to ask your doctor because by asking, that's when you learn and that's when you understand why things are being prescribed to you, why things are being recommended to you. Okay, so thank you for watching and that's it for me tonight. Sheila.
Thank you, sir. Thank you, Doc. Those were very, very encouraging. Okay, having this topic tonight. Okay, just before we say goodbye, all right, very, very quick. Next week, just before the Thursday, webinar Thursday, we'll be having in collaboration with the Rotary Club of Comuni and also Rotary Club of Pearl of the Orient. We are having a special webinar entitled Cancer Solution and Prevention. It is in our Facebook, and you can see the registration link. It is still also open for everybody. You can join that one. And also for our next Thursday webinar, it's already December 1. Wow. Yes, and it's happening 7:30 as well. The title is Cancer Journey, Actions to Take After Diagnosis.
I think this is good. This is what you do the moment you have been told that you have cancer. So that's a very scary thing to find out that you have cancer. So I think knowing exactly what to do next will be assuring, all right, to be able to know what the plan is. Yeah.
Okay, for those people who want to have a consult with Doc Jansen, the link for you to book a consult with Doc Jansen is already on the description. But if you can also type in how to consult and they'll get in touch with you individually. Also, just to let you know, restock alert, everybody. Okay, in our Lazada and Shopee, we already have the Cleansing Plus is now available once again. So as you can see, all the diabetes and also cancer packages are now restocked and available once again.
Wow, yeah. There were so many people who got the protocols that we momentarily ran out of stock. So glad that the shipments came in. Yeah, go get them.
Thank you, Sir Sean. So once again, please follow us on our social media, Facebook, and of course YouTube. And for those who wish to learn more, of course, our website is www.simplynature.asia. Thank you so much once again for watching our webinar for tonight. And of course, we hope to see you once again in our next webinars to come. Because here in Simply Nature, we are always with you from start to healing. Thank you, everybody. Good night, and God bless you all.